Good afternoon, colleagues. Thank you all for taking your time to join today's webinar series. This is our second part. My name is Dr. Budani Mukoma. Good afternoon once more. Just to introduce myself again, for those who probably just joined our webinar not so long ago, my name is Gudani Mukoma, and I am from the Department of Biogenetics, Recreation and Sports Science, Faculty of Health Sciences at the University of Venda. So this is our second part of our qualitative health research webinar series. Yesterday, we covered on, data collection methods for qualitative data. We expanded on, the tools that we use to collect data, designing an effective semi-structured interview guide, as well as, how practical application of how you can, the steps involved in developing the guide. So, yesterday's webinar was the first step into, acquiring or getting the data that we'll need. So today's part will be covering, those aspects that after you've done your data collection, then what from there? What is the way forward? Which is obviously analyzing the data. So today's topic will be maximizing thematic analysis and leveraging both inductive and deductive approaches. Okay, so the objectives of this webinar are to help you understand the meaning of thematic analysis, which we'll be referring to it as TA, and describing the steps for conducting TA, understanding inductive and deductive approaches, understanding definitions of codes and themes, as well as determining the types of coding used in thematic analysis. So before we can go even deeper, I would like us to start by, clarifying what thematic analysis is, or just giving some context around it. So for those who might not be familiar with qualitative analysis, thematic analysis is a method for systematically identifying, organizing, and offering insight into patterns of meaning, which are referred to as themes. And this is across the entire data set. Thematic analysis prioritizes the exploration of meanings across the data set, facilitating an understanding of collective or shared experiences. And this will allow a researcher to identify overarching themes rather than concentrating solely on a unique or idiosyncratic meaning, which is inherited to individual data items. So this method is a way of identifying what is common to how a topic is talked about or written about, and making sense of those commonalities. The patterns of meaning that thematic analysis allows the researcher to identify obviously need to be important in relation to the topic and research question being explored. So this type of analysis is suitable for various types of qualitative data, and that is including those that we covered yesterday, which are in-depth interviews and focus group discussions. So just keep in mind that analysis is saying, what does the data say? And then interpretation is saying, what does the data mean? So why choose thematic analysis, or why use thematic analysis? So thematic analysis is widely used in qualitative research, and mainly because of its flexibility, accessibility, and ability to generate rich insights into the data. So there are various advantages that thematic analysis offers, and I'm going to go a little bit into details about these benefits. So number one, which is the flexibility. So it can be used across a wide range of research questions and data types. That includes interviews, focus group discussions, surveys, text, audio, or video. So it's not necessarily tied to a specific theoretical framework, so the researcher can use it in various contexts, whether conducting exploratory, descriptive, or interpretive research. It's also very advantageous when trying to identify patterns. So this helps the researcher identify and understand patterns or themes within qualitative data. This is useful for uncovering insights into how people think, behave, or feel about a particular phenomenon and how different themes interact. It also has an advantage because it uses a data-driven approach. So thematic analysis allows for an inductive approach where patterns and themes emerge directly from the data rather than being imposed beforehand. This makes it particularly useful when researchers do not have predetermined hypotheses and want to let the data speak for itself. Sorry about that. So thematic analysis is also, good as it allows rich and detailed analysis. This means that it allows for in-depth analysis and exploration of the meaning behind participants' responses or behaviors. Researchers can capture nuanced aspects of participants' experiences, highlighting commonalities and variations within the data. It is also useful in organizing complex data. We know that qualitative data can be a bit cumbersome. Qualitative data is large. Therefore, it might be very difficult for one, especially those who are inexperienced, to manage this data. So thematic analysis provide a systematic way to organize, correct, and categorize, and then make sense of large amounts of data, which can help researchers coherently structure their findings. It also allows for transparency and rigor. So this means that, it allows for clear documentation of how themes are defined and interpreted, which helps ensure rigor and credibility in the analysis process. It also facilitates reporting findings to stakeholders or within academic papers. Thematic analysis is also useful in pre-existing frameworks. So remember earlier on, I've talked about how it does not necessarily mean for you to use it, you need predefined themes or codes. So thematic analysis can also be useful in pre-existing frameworks. So I'm going to explain a bit deeper in the next coming slides. But what this means is that researchers can use it with established theoretical frameworks or develop their own coding themes based on the data. This makes it versatile for both theoretical and empirical studies. It also allows for engagement with subjective experience. So it captures subjective experiences and meanings, making it ideal for research that explores people's emotions, perceptions, as well as lived experiences. Thematic analysis is also exploratory or explanatory. So it can serve as both exploratory purposes, which will be useful in identifying new areas of interest, and also in explanatory purposes, which will be useful in understanding the reasons behind a certain phenomenon. It offers actionable insights. So for instance, in applied research, actionable insights can be provided that may influence practice and policy. For instance, in a case where analyzing patient experiences in healthcare may lead to better services. So what are the key benefits and applications in health research? So like I've highlighted before that thematic analysis has some certain benefits. And this includes, it offers deep insights into complex health-related behaviors, experiences, and perceptions. It also provides a rich, nuanced understanding of patient experiences, healthcare policies, and also public health issues. So how does it apply in health? So the application of thematic analysis in understanding health-related, phenomena or conditions or situations is that it offers an understanding of how people perceive or interpret a situation, like how patients perceive doctors in a hospital setting. It also offers an exploration of personal experiences, such as young women's experiences using contraceptives. It also allows an investigation of public ideas or opinions on broader topics like the COVID-19 vaccination. It also allows for analyzing how influence of cultural constructs influence health-seeking behavior, as well as perceptions on medical care. So those are the benefits of thematic analysis, particularly in the field of health sciences. So talking about flexibility and choices in thematic analysis. So like I've mentioned that, thematic analysis is highly flexible and it can be executed in various ways. There are three main primary areas that aid in understanding different qualitative research methods. Number one, which is the inductive and the deductive or theory-driven data coding and analysis. Number two, which is an experimental versus critical orientation to data. And number three, which is an essentialist versus a constructivist theoretical perspective. However, for this webinar, we'll be focusing on the inductive versus deductive approaches. So what is inductive and deductive approaches in thematic analysis? So inductive approach, here, themes are data-driven. This means that they are emerging organically from the data without preconceived categories or frameworks. This type of approach focuses on exploration of raw data to identify unique insights. A good example of this would be coding participants' responses to identify new themes about experiences with healthcare. So we use this when there is little prior research existing, as well as when we want to explore or when we want to explore or discover new insights. And then following that is deductive approach. So this type of approach is used when themes are theory-driven. This means that they are guided by predefined concepts, theories, or research questions. It focuses on confirming or testing of existing frameworks. A good example of this is using an established framework, such as the health belief model, to analyze themes related to behavior change. We use this when we want to use a specific theoretical framework or a model to understand behavior, or when aiming to test or expand upon existing knowledge. So just to compare between the two, so that this could be quite easy to understand. So for instance, an inductive approach is data-driven, when a deductive approach is theory or prior research-driven. An inductive approach is flexible. This means that themes evolve during analysis, whereas a deductive approach is less flexible because themes follow a predefined structure. And the purpose for inductive approach is discovering new patterns, when the deductive approach is for testing or refining existing knowledge. And good examples of this would be, of an inductive approach would be generating themes from interviews, whereas for deductive approach, we'll be applying the health belief model in analysis. So Brown and Clark have developed this framework, a 6-phase framework, into understanding how thematic analysis can be done. So this is a simple diagram that will just help you understand exactly the process or the steps for doing your thematic analysis. So step one, which is gathering the data, and this is followed by step two, which encourages you to read all your data from the beginning to the end, which is also known as data familiarization. And then step 3 is now when you start to code the text based on what it's about. Step 4, you now create codes to encapsulate potential themes. Step 5, you take a bit of a break. And then step 6, evaluate your themes for a good fit. So I'm going to talk a bit more on how these different steps link into one another. And at the end of the day, you have what we call fully analyzed data. So this is the most critical step, as it now assists you to, to become familiar with the data. So in this step, the key thing, or the first thing you'll do, is to start by reading the transcripts. So this is after you've conducted your recordings and your data has now been transcribed to text. So you have to take time to read and reread your transcripts. So after that, you will conduct an initial read through the transcripts and or notes from participants' observation documents and so on. So from there, you will then be having some idea of, how your data is like. So it's important that as a researcher, you immerse yourself with data to familiarize how much depth and breadth you having in your content, of the content, sorry. So at this stage, it is useful to make notes and jot down early impressions. So once transcribed, interview transcripts should have margins on the left and right sides of the text for coding, particularly when using hand coding techniques. So for those who are familiar with coding softwares, this can be done on the window of your laptop. So participants' observations protocols typically include a left column for descriptive notes and right column for reflective notes used together in the analysis. And this is often to bolster or triangulate findings from the interview guide. So this is mainly just talking about, when you're reading, you need to be making notes as you go through all the transcripts of your data. So a good example on, the kind of notes you can make, would be, as I've put an extract here. So the patients do seem to think that feedback is important, but don't always find it useful. There is a sense that the whole screening process, including feedback, can be seen as scary and is not always understood. The patients are very clear that they want very specific feedback that tells them how to improve their health. They want to be able to discuss their health on a one-to-one basis with doctors, as this is more personal and also private. The emotional impact of feedback is also important. So from that, now that you've made yourself familiar with your data and you've now started to put your notes, you now start to generate initial codes. So codes and coding are sometimes called labels or labeling. So codes are labels that assign symbolic meanings to the descriptive information compiled during your study. This is vital to code each data segment relevant to or capture something interesting about the research question. A code can be a word or a short phrase that represents an idea. So coding will allow you as a researcher to simplify and focus on specific data characteristics. So researchers will then see themselves move from unstructured data to developing ideas about what is going on in the data. So from there, that means now label can be about actions, activities, concepts, differences, opinions, processes, or whatever you think it is relevant. Remember, this is guided by the question at hand. You can also decide that something is relevant because, number one, it is repeated in several places. Number two, it surprises you. Number three, the interviewee explicitly states that this is important. Number four, you have read about something similar in previous published research. Number Number 5, it reminds you of a theory or a concept. So after that, then now you have now started to, code your data, and you have now started to create your labels. There are various types of coding processes that you need to understand. And this will help you fully, write down how you performed your analysis, because this is quite important to when you're reporting your findings, exactly how or what were the steps that you took into analyzing your data. So there are three approaches or three types of coding your data. Number 1, which is structural coding, which is also known as index coding. Now, this type of coding is deductive and is theory driven. So here, the coding is based on questions, and that will involve research questions, interview guide questions, or topics of inquiry. And then we have descriptive coding. This type of coding is inductive, which means it's content-based. Here the coding is of basic topics, and this is mainly driven by the data that you will be having. And then another type of coding is process coding. Here, this type of coding is inductive. It focuses on actions, behaviors, or processes. And this typically uses gerunds, which are verbs ending in ing. So we typically uses gerunds to code action in the data, and this is frequently used in grounded theory. So I've included some examples on how you can go on about creating your codes and themes. So for example, you can now, after you've immersed your data, you've now started to, generate, initial codes. And then from those codes, you will be able to now put together what we call themes. And perhaps one of your themes could be, since we are talking about patients' feedback, would be, the purpose of feedback. And then you will have various codes that would be arising from the data. So remember, I said that the number of times the codes would be coming would help you, now formulate what we will call a theme. So, for example, your codes could be help to learn what you're doing, unable to judge whether questions have been answered, unable to judge whether questions interrupted properly, improving knowledge or improving health. And then on emotional response, you can have codes such as like to get feedback, difficult for patients to predict impact, patient variability in response to feedback, feedback taken personally initially, and so many other codes that you can. But this is how you'd want to categorize or arrange your data so that it's much clearer to see how many of these codes are coming up several times. And this will help you now fully understand whether this is something of interest and something that you should be reporting on. So this is just a step further to, the coding process. Now, this is now going to organize it in a way that, we are able to have a transcript. So this is an extract from the transcript. And then your notes. And then from there, after your notes, you get your codes. And then from there, lastly will be your themes. So this is a good way for you to see, everything clearly and in a much more meaningful way. So when you're doing manual coding and you have a table like this, in most cases, people use Excel to do this because it makes it easier to arrange the columns. You can therefore be able to, link, common themes together, common codes together, and therefore be able to make meaningful interpretation of your data. Okay, so the next step after you have now started the coding process, is to now search for themes. So a theme is a subjective meaning and cultural contextual message of data. A theme is a red thread of underlying meanings within which similar pieces of data can be tied together and within which the researcher may answer the question why. So that why in the beginning is quite important when you're now thinking of the themes that you'll be using to interpret your data. So after examining the codes, some of them, may clearly be fitted together into an initial theme. This is exactly what I was just talking about in the previous slides, that some of these themes might be related or might be similar. So therefore, you will now lump all of these codes so that you can make much more meaningful, and then you will have more depth into the subject matter. So the themes are produced at this stage, are considered preliminary. And then step 4, which is now involving the reviewing of your themes. This is quite important because now, we know that themes should be coherent and they should be distinct from each other. So at this step, you may delete themes or collapse themes together and identify some sub-themes. So the things that you need to think about when in this process, you ask yourself these kind of questions. Do the themes make sense? Does the data support the themes? Are there themes within themes? That means sub-themes. Are there other themes within the data? So in my previous example, upon reviewing the themes, it has been found that a sub-theme can be established under the emotional response to feedback theme. So therefore, a feedback as a potentially threatening, can be generated as a sub-theme within a broader theme, which is emotional response. So just to go back to show you what I'm talking about. So this is the theme that I'm talking about, that this theme can be collapsed, or you can create another sub-theme from it in order to make much more meaning to it. Right, so this was just another example just to explain how you can generate a sub-theme from the overall or the bigger theme. So we have our theme, emotional response to feedback. So like with a few examples there that talks about, a patient likes to get feedback. It's difficult for a patient to predict the impact, patient variability in response to feedback. And then our sub-theme there will be feedback as a potentially threatening. And this here you will have information that will talk about, patient does not want to feedback if not adhering to treatment, reluctance to hear criticism, fear of possible criticism. So anything that will be, quite negative can fall into this kind of theme. Therefore, you can now, be able to now say that, okay, everything that is under this theme was explaining how the patient or the participant was not adhering to a specific treatment due to that they had the fear of having this negative feedback. So at the end of this phase, now as a researcher, you will have a good idea of the different themes and how they fit together, as well as the overall story, you can tell about your data. So from here now, you will be able to see, what are your themes and what are your sub-themes, and, what is, making up all these themes and sub-themes. So in this case, you will now move to your step 5, which is, somewhat a final refinement of the themes. And the aim is to identify the essence of what each theme is about. So during this phase, a detailed analysis for each theme is written, and identifying the story each theme is telling, while considering how each theme fits into the overall story about the entire data set, and which will be in relation to your research question. So in this stage, Renaming for themes can also be done. So this means that if there are some themes that you feel like they are quite similar or they are, talking about the same thing, you can now, rename them for even more clarity. So theme names need to be punchy and immediately give the reader a sense of what the theme is about. Sorry. So a solo researcher here may consult outside experts to determine whether the themes are sufficiently clear and comprehensive. So the process of peer debriefing with someone who knows a great deal about the area of inquiry and the method of thematic analysis will help expose the researcher to aspects of research that might otherwise remain unspoken. And then lastly, the last step is now the write-up step. Usually after all your findings and themes have been arranged, you now, your endpoint is to now write some kind of report, often for a journal article or dissertation. So from here on, direct quotes from participants are useful, for putting together your final report. So literature can also be used to confirm the research findings as well as provide an opportunity to challenge and add to the literature. So many authors recommend submitting the analysis for participants for their feedback through the process of member checking. So just to take a bit of a look on some of the tools that can be useful when doing qualitative analysis. So remember in the previous slides, I had talked about that you can do what we call manual coding. So manual coding is useful when you do not have the technological means to analyze your data. However, very recently, or with the technological advancements, there are many tools that are available which can help, organize your data, manage it. So regardless of how large it would be in a manageable way so that you can, conduct your analysis much thoroughly and also clearly. So obviously the choice of tools to use depends on the scale of your project, the type of data you are analyzing, and whether you're working with an inductive or deductive approach. So for inductive thematic analysis, tools like NVivo, MaxQDA, Atlas TI, and others are excellent for generating codes. So these tools can also be useful when using a deductive approach. So it's quite important that, you need to be quite familiar with how to use these platforms for you to make, adequate use of them. Because otherwise, if you do not know how to use them, it might just be challenging when you're managing or creating or generating codes as well as leading up to your themes. So I think I will just stop here for now, and I would like to take some questions before I can have my own questions that I would like to ask to the audience. So feel free to raise your hands. I'm just going to go through to the chat box. Okay, so I see there's a question in the chat box, and this is from Rosaline saying that would consulting an expert adequate to a co-coder, or that's different? Yes, so this is very much similar. So this, remember, after coding your data, you as the initial coder would need another review from, it's either, if you're having, let's say, other researchers or other co-authors on the paper that you'll be working on. So these people or these researchers will be assisting you with, reviewing your themes and ensuring that they now are talking to the research question that you have, as well as, being clear in a way that, they are actually, showing the meaning of what the data is saying. So, but this is only going to assist into providing clarity for your themes. Remember, you are the one who is going to familiarize yourself much deeper into the data. So it will be quite important for you to, have this sort of consultation quite earlier on. So another question is, will the presentation be shared with the audience? Yes, I think the the presentation will be shared. Just like yesterday's presentation, it was shared with everyone who was attending. So I don't see that as a problem. So another quite important thing that I would like to share about, the process of coding is that, when you are, especially when you're doing manual coding, it's important that when your initial themes or your initial code, you don't, get rid of it after you've now moved a step further to, or to coding. So you keep each and every file, because in some instances, it might be very useful for you to go back and relook at, how you started your coding. This will be, also be helpful in terms of detailing the steps that you took when generating your themes. Okay, so I see Ditobe has asked if I can repeat on how to develop themes. And then there's another question: what are transcripts in thematic analysis? What are the procedures for coding in qualitative data? Okay, so I'll start with the transcripts. So, Ernest, so after you have, conducted, whether it's your in-depth interviews or focus group discussions, during that process, you will be recording the data. Remember, with qualitative research, we do not, gather any analytical or, any numerical data. So therefore, whatever we will be gathering will be verbal data, which is reliant on the subject, or what we call subjective data. So here you will have to get permission from your participant to record, and those recordings will now be transcribed to words or text. So I've explained this yesterday, that you will use, services of, qualified or professional transcribers to ensure that, the validity of your data is good. There are also some, AI or softwares that you can use for the data transcription. However, there's errors with those. So it's quite important that, you choose the method which is going to ensure you the best data quality. So the transcription will then give you what we call transcripts. So this is everything that the participant was sharing with you. And from there, you can be able to read and understand, what exactly was the participant feeling, or what insight did the participant share with you pertaining to a specific question that you had asked. And obviously, there could be other things that will come out which were not necessarily what you asked, but they would be of relevance to, the question in mind. So, and then the coding process is those 6 steps that I was just talking about, which, number 1, I'll just go back to that slide now to just give it more meaning. Just a second. Great. So these 6 steps, I hope you can see, these 6 steps are what you are going to do for you to start coding your data. And this includes, number 1, familiarizing yourself with the data. So this is the reading part where, you've received your transcripts and then you start, reading them just to understand, how the data is like. And then from there, you move to the next step, which is now reading and starting to make notes. From there, you will now start reading and then coding your data. So if you can see on my slide, there are various, notes pasted around the paper that is showing you that you need to now to start thinking, okay, this, I'm going to label it, unhealthy behavior, or I'm going to label this code, negative feedback. However you would like to, label your code depending on the context of the research question. And therefore, you will do this across all transcripts. And after this, then you will now look, at all those codes. And from there, from those codes, you'll be able to now, start developing potential themes. So themes obviously could have a bit more detail, such as, unhealthy eating behavior, or, negative feedback as a threat. Other examples could be, being unable to, live without, medication. So anything that you think would be useful in giving clarity, and also it has to be in a punchy way. So it has to be interesting enough for a reader to get, that, this is something which is quite outstanding, and also quite important to, expressing the views of the participant. So from there, you can, go back and now just, look at all these themes that you have generated. And now you can start seeing which other themes can be linked together, or which other themes can be now broken into sub-themes. And from there, you will be able to finalize your coding process. From there, after you're done with that, that's when now you just go all together and you just reevaluate your themes. And that's the part where you can now involve another member of the team, or another researcher, or an independent researcher, to check your themes and just give some confirmation on, whether they are capturing what you intended to capture. I hope I was able to break it down for you simply and nicely there. There was another question, which was from, so Dito just asked me on explaining how to develop the themes, which is what I just did right now. So do ask me anything further if that was not clear. Great. So Miyahawa is asking about how do you identify participants in your recordings? Yeah, so I shared this yesterday, that during the start of your interview, you have what we call a descriptive, way of introducing your participants. So for example, if it's an in-depth interview, you will say you're meeting with, you're having an interview with a male. Obviously, you'll not use participants' names, because that will breach the issue of confidentiality. You will say you are going to have an interview with a male participant, or a 37-year-old man from, Toyando in Venda. And the topic that we're going to be talking about is this. So that's another way of doing it. There's always various ways of, ensuring that you can be able to identify your participants. However, in a focus group discussion, you can use first names only, because it's going to be a bit challenging for anyone to even if we say Gudani, but which Gudani is it? Unless if you say Gudani Mukoma, then that's easy for people to identify. So you can utilize first names such as Gudani, David, Jake, or Daniel, however the participants' names would be. Unless if the participants are not comfortable with that, obviously you would have to get their approval. You can assign numbers, unique numbers that you feel will be easy for you to recall on your, when you do your analysis. Obviously, your note-taking process will also assist you in this regard when you want to now analyze your data. So you just have to ensure that everything that you do during this process is detailed and neatly written down so that you do not miss out any key information. I hope that explains it. So I see that there is another question that says, thank you. Given the inaccessibility of data analysis software such as NVivo, Atlas TI, due to licensing fees, how acceptable is the manual data analysis if one is writing for publication? Thank you for your time. I'll tell you that it's very much acceptable. I've written, I think most of my qualitative papers that I've written, I actually used manual coding. And that was for the very same issue that, licensing fees are expensive. So because these softwares are quite pricey, and unless you have a funder that is going to give you the money for you to purchase these licenses, it becomes a challenge, especially when you're a student. So the process that I just talked about now, the 6 steps, can allow you to analyze your data and produce really good quality findings, even though you'll be doing it manually. So it's applicable in all those instances. So obviously the software is just there to assist you with speeding up the process and obviously managing your data better. But I've found Excel spreadsheets to be quite useful in this case as well. Obviously, you just need to, be very smart in terms of how you do it. For example, some people will use, different colors to shade different columns. Others will use, several spreadsheets where, they start building on, the coding and moving on to, the first initial theme identification, and then after that, the refining of the theme. So you'll have separate spreadsheets with, different information available. So in that way, you are able to get an overview of where you started and how you ended. Yeah, so it's quite acceptable for you to do manual data coding or data analysis in qualitative, as long as you are able to detail the steps of how you did it in the end, especially when you're writing for publication. And Sizwe shares that inductive themes are data-driven, emerging organically from the data without preconceived categories, and then deductive, driven by theory or prior research. And then Peggy shares that inductive aims to make inferences to develop a hypothesis, and then deductive tests an existing theory and uses existing theoretical framework. Yep, all of you are spot on. And I think, we practically are on the same page. And then I see now, Rosaline says, deductive approach is guided by existing theories of literature, while inductive approach is used to generate new theories or ideas from the research data. And then Nomkosi says that deductive analysis is using themes from theoretical or conceptual frameworks, whereas inductive analysis is creation of themes from the data. Very much correct. I'm happy to see that everyone now understands the differences between inductive and deductive approach. So I think we're going to move on. And just to try and wrap up our session. So before we just close off, I would like to, leave you with some of these key take-home messages, and I would hope that this would be useful when you, engage in further study, as well as when you now start with either your data collection, as well as, when you now start to develop an analysis plan for your qualitative data. So it's quite key that you bear in mind that thematic analysis is flexible. So this means that it allows you as a researcher to analyze your qualitative data systematically while adapting to the research context. Thematic analysis supports both exploration, which is inductive, and verification, which is deductive, of themes. So an inductive approach highlights discovery. During this process, themes are data-driven and they emerge naturally from participants' narratives. This is ideal for studies aiming to uncover new patterns, insights, or perspectives. An inductive approach encourages a bottom-up process that centers the voice of participants. And then a deductive approach, which leverages on existing knowledge or theories. So here, themes are theory-driven based on the pre-established frameworks or research questions. This approach facilitates a top-down process, ensuring alignment with specific theoretical constructs. It is effective for testing or validating concepts within a structured framework. So combining both approaches enriches your analysis. This is now when you're not just relying on one approach. So by integrating inductive and deductive methods, you will have a balanced approach. So combining them will see you being able to now create novelty of emergent themes with rigor of theory-based analysis. So it also enhances the depth and applicability of your research findings. So some guidance for using these approaches is that you should choose an approach or a combination based on your research objectives and context. Clearly document your method to ensure transparency and reproducibility. Recognize the strengths and limitations of each approach in interpreting results or findings. So relevance to qualitative inquiry. So both approaches emphasize the importance of understanding complex human experiences, and they enable thematic analysis to adapt to diverse research questions and disciplines effectively. So here are some references that I used in order to prepare these slides that you're seeing here. You can use this and as well as consult other books for you to further study so that you can be able to be much more familiar with the approach or with the data analysis method of thematic analysis, as well as utilizing the two different approaches, which is deductive and inductive approaches during thematic analysis. I would like to thank you for your participation in today's webinar session. If you have any further questions or would like to connect, feel free to reach out to me in the shared contact details on your screen. And I look forward to hearing from you, and all the best with your research endeavors, and looking forward to continuing the conversation. Thank you.